give an update on what's been going on since last Friday, the last time we talked to him. Eddie, thank you so much for joining us. We really appreciate your time.
Of course.
So I want to talk about numbers. The first thing I really want to talk about is the difference between today and May 1st, which was 2 Fridays ago, which is the typical symptoms, the time that you see that 14-day symptom lapse. So especially since we moved from a high-risk phase to this orange moderate risk phase, we're opening up more dine-in restaurants. We increased the gathering to 20 people as opposed to 10 people. So our case count 2 Fridays ago was 4,979 cases with 53 deaths. And today we're at 6,913 cases, 77 deaths, and 566 hospitalizations. Can you talk through a little bit about what those two numbers mean and if there was an increase and kind of what that means for the state right now?
Yeah, so what we look at to really give us an idea of growth is your daily new case rates or case counts. And so we really closely follow how many new cases are identified each day. And we do that within Intermountain. We also follow Utah Department of Health site, which brings in data from all over the state. If you look from May 1st to present, what you see is that the number of new cases per day has remained stable.
Okay.
We really had an increase in cases from kind of mid-March all the way to really kind of the last week of April. And then really since the last week of April till now, the cases per day have remained stable. Okay. And so they're not going down. We wish they were, but they're not, don't appear to be going up based on the past 2 weeks of data. And so, it's hard to interpret, how do you interpret that? Well, one way to interpret it is to say, well, listen, we went from red to orange May 1st, and we've now gone 2 weeks, which is a good full incubation period. We should be seeing new cases that potentially were due to moving from red to orange. And we haven't seen an increase, okay? But we also haven't seen a decrease. And so it's hard to say what would have happened if we would have continued in the red status and maintained really strict social distancing May 1st. It may have been that we would have seen a decline in cases. And what we're actually seeing now that we're in orange is just a steady state of cases. I suspect that is really what's happening here, is that we're still seeing community-based transmission. It's out in the community. It's not increasing dramatically. But we still are seeing new cases every day, and we see about between 100 and 200 cases per day across the state of Utah. If you look at just Intermountain, what we follow really closely is the hospitalized census of patients with COVID-19. So how many people that are in our hospitals have COVID-19, and that has actually stayed real stable. It's kind of gone up, gone down, gone up, gone down, and right now we're right around 70 patients per day in our facilities across the state are admitted with COVID-19.
Okay. So also Mother's Day was last weekend. So I know that was kind of one of the second opportunities after Easter for people to start gathering or feeling a little bit more comfortable with gathering outside of their household. Could we potentially see the increase of that? And if so, what numbers should we look at in 2 weeks from last Friday or Sunday, or what's the good time range to kind of judge if a big event like that made a difference?
Yeah, so you're right. Mother's Day was last weekend. We saw a lot of people out and about, especially at home and garden stores. People, definitely getting out. We went for a hike up in Mill Creek, and all the picnic areas were fully packed with people. So yeah, people are out and about, and they were in droves last weekend. So what we'd expect is that the incubation period for this virus on average is 5 to 7 days. And so if Mother's Day was really a big transmission event, 5 to 7 days from then is really starting now. So Friday, Saturday, Sunday would really be 5 to 7 days. And then you got to give people a little time to recognize the symptoms and then get in for testing. And then that testing needs to be reported to the state. And so I suspect that if we're going to see a transmission event due to Mother's Day, we're going to really see it reflected in the numbers starting next week and into late next week. And then when you think about hospitalized census, once you have the infection, it typically takes 4 to 5 additional days for your symptoms to get severe enough where you warrant going into the hospital. And so we are going to see a potentially impact on our hospitalized census. That won't happen most likely until probably next week, Wednesday, Thursday, Friday. So next week is really going to be the time where we're going to be able to say Mother's Day was a significant transmission event.
Yeah, I know that I saw a lot more people out and about, and my drives to the office have gotten a little bit longer because of the traffic. So that's been interesting to kind of see. We also got a question recently on one of our Facebook posts. This family lives near a family that tested positive for COVID-19, and they're displaying symptoms right now. And they said that they were still leaving their house and going grocery shopping. And this family wanted advice on what they can do to keep themselves safe and protected from potentially community transmission.
Right. I mean, so first a comment on that. If you've been diagnosed with COVID-19, SARS-CoV-2, it is your responsibility to stay home, self-isolate, and do not come into contact with anybody or the environment. That's a moral responsibility that we all need to take very, very seriously because spreading that virus can certainly kill people. So that's just one thing. The second thing is that we know that this is going to happen, whether it be intentionally or unintentionally. And so we need to make sure that regardless of what color status we are, red, orange, yellow, green, as long as this virus is circulating in the community, everybody's at risk. Okay. And so that means when you're out in the community, it's good hand hygiene. It's maintaining 6 feet of distance. It's wearing your face mask in case you are infected and potentially spreading into the environment. We're going to have to maintain that as long as this virus continues to spread in the community. And if you have symptoms, regardless if you've been tested, if you have symptoms of COVID-19, cough, shortness of breath, fever, even diarrhea, loss of taste or smell, those types of things, you need to stay home. You need to self-isolate and just not come out in the community. And I think the last point I'll make is that people can have outward signs and symptoms of COVID-19 long after they're infectious. And so we know that when you get infected with a viral infection, you may have a lingering cough for weeks to months. Okay. It doesn't necessarily mean that you're infectious, but it may mean that you have symptoms. And so I don't want to, pass judgment. I want to make sure that we give these people the benefit of the doubt. They may have reached their end of their self-isolation period based on CDC guidelines, meaning you've had symptoms for at least 10 days, or it's been 10 days since the start of your symptoms. Your fever has been gone for the past 3 days, and you've had improvement of respiratory tract infection symptoms. As long as you meet those requirements, then you can get out and move about in the community. But if you haven't met those requirements, people with COVID-19 need to stay home.
So to protect yourself, if that happens to, like you said, I would just avoid contact with them. And like you said, we can't really dictate what other people do. It's about keeping ourselves safe and hoping that other people are following suit with that. I had a really interesting conversation last night with a friend about COVID-19, and we were talking about different ways of transmission, and blood came up. And I don't know if we've ever talked about this, but I was curious, and I think some people are, is it transmissionable at all through blood? Or is it just more of the saliva and particles that come out of your mouth?
Yeah, it's more the respiratory route. There's been studies looking at viremia, meaning having actual virus in the blood. And the last one I read showed that didn't identify anything. So bloodborne is not likely a huge risk. And then we've also seen studies looking at it for stool transmission. And they can detect the virus in stool, but they haven't been able to grow the virus. And so we're not really sure what that means. Definitely predominant route of transmission is respiratory. So nasal and oral secretions and respiratory secretions, cough, sneezes, those types of things. That's the predominant form of transmission.
Okay. And we've talked a little bit about this too with the fall coming. It's closer than we think it is. Are we still kind of tracking to see that there will be a second wave of this potentially come August, September, October? We're basing this on projections. We're basing this on our knowledge of respiratory viruses, on previous coronaviruses.
We know that the 4 other seasonal coronaviruses come and go, and they particularly peak in the winter months, like really starting December, January, February. Yeah. We know influenza is definitely seasonal, and so we see that kind of really decrease come March, April, May. We suspect that unless there is an effective vaccine or therapeutic, that we will most likely see this virus again in the fall, and potentially, early winter. That is our best guess, and I think that's based on the fact that other coronaviruses are seasonal. We don't have any kind of big community-based immunity to this, and we don't have any therapeutics. So I suspect what will happen is our numbers will eventually come down, be intermittent cases in the community, and then we'll start to see a spike in the early winter. That's our best guess based on just the way seasonal viruses act.
You mentioned a vaccine and therapeutics too. I know that we're doing antibody testing right now, and I know it just started. Is there any updated information on what those tests mean to the community and epidemiologists as we kind of move forward with this?
Yeah, so we're watching the literature really closely in terms of what does a positive antibody mean. We suspect that a positive antibody will correlate with some level of immunity. We have no idea what that looks like. So when we look at this and we see the different reports coming out, a positive antibody definitely correlates with what is called neutralizing antibodies, meaning that they're antibodies that actually neutralize the virus and are effective. That said, we have no idea if that immunity is going to be protective, where it means like you can't get infected with SARS-CoV-2 again, or is it the fact that it just kind of dampen down the severity of an infection that occurs later on. We don't know how long that immunity would last, if it even exists. So we still have, so many more questions than we have answers when it comes to an antibody-based test. All we can say is that the test likely means, if it's positive, that you were infected with SARS-CoV-2 previously. We can't say anything based on immunity. In terms of the recent data, there's a very large seroprevalence survey ongoing, led by the University of Utah and the State Health Department, called the HERO study. That's probably going to go on for a number of months, but that's really going to give us the best estimate of what our prevalence in the community is of infection with SARS-CoV-2. We don't have any results on that yet. There are results coming in from different countries. Spain just completed a big seroprevalence survey, and if you remember, Spain got hit really hard. They were part of that kind of Western Europe epidemic, along with Italy and France and Spain and Germany. They had a really hard time with this virus. And their seroprevalence in their community is only 5% based on their recent study. And so when you start thinking about herd immunity, and we've heard a lot about this, herd immunity is at 60 to 65%. And so we're a long ways from any kind of herd immunity. And we don't even know if herd immunity exists, because we don't know if an antibody actually is protective. So learning a lot, it's coming in quick, and hopefully we'll have some more information about immunity. But honestly, the definitive answer won't come until we go through another round of surges to see who's getting infected and who's protected.
Yeah, that's interesting. I think it's good to look to other places to see what they're doing. I know you guys learn a lot from that, so it's a good resource. We had a question come in on the chat that the CDC recommended washing all your groceries after you got home, and now they're saying it's not needed. Do you have any suggestions on if this is still needed with groceries and takeout, if you can answer that? And they also asked about wearing eyeglasses to protect your eyes as well.
Yeah. Well, I can tell you what we do in our home is that we don't wash our groceries. We don't wash our takeout. We are more focused on social distancing and good hand hygiene. And so we're not seeing mass outbreaks in terms of contact tracing of people getting infected from grocery stores. That kind of thing, those kind of point surveys would really direct us to that. And we're just not seeing that. And so it's not something that we do. And, we're at a little higher risk considering we have a newborn in the house. But I agree with the CDC, it's not needed. And, on porous material like cardboard and paper bags, the virus doesn't appear to be living there very well. And so I think I would focus your efforts elsewhere and say, good social isolation, good hand washing, wearing face masks is the way to go. The question about wearing eyeglasses to protect your eyes, not recommended. We wear face masks not to protect ourselves from getting infected from somebody else. We wear face masks so if we have the virus in our nose and our mouth, we're not spreading it in the community. That's the reason we wear face masks. It's not because it's protecting us from inhaling the virus. We really protect ourselves from inhaling the virus by really following social distancing and remaining 6 feet from other people. So if they do cough or sneeze and people have the virus, those big viral particles will drop out of the air before they hit you. Eyeglasses not recommended for the community at this time.
And with the grocery thing too, I feel like it also is a personal thing too. If you feel, we've been washing groceries and I probably will stop eventually. But there's some part of my brain that feels like it's helpful for me. I'm not high risk and I live with no one who's high risk, but it takes 5 seconds for us. So to that person's comment, I think it's also your personal preference. If the science is saying that you don't need to, but you still want to, it's not going to hurt you as long as you're not ingesting the chemicals and making sure that you're cleaning it properly, I would say.
Yes, please don't ingest the chemicals. If you were to prioritize, you may want to clean fruits and vegetables that you ingest directly, like an apple, for example, maybe something you'd want to wash down. I think that's good practice just in general. Lettuce, for those types of things. But run of the mill, like your box of pasta, I wouldn't be wiping those things down.
It's also a good point too. I guess you're not eating the packaging of something, so you're probably less likely to get it. I don't really think I thought about that.
Wash your hands after you're done unpacking your groceries, and maybe wipe down your counters, and you call it good.
Well, you'll keep my grocery experience quicker now with that. So another thing that's come up recently in the news is this multiple system inflammatory syndrome in children. We've been hearing about some cases in New York. There were some deaths related to that that was likely associated with COVID-19. Do you have any experience with what's been going on here, or is there things that we should look out for if we have children for this specific instances?
So a huge disclaimer, I'm not a pediatrician. The last time I saw a child in the medical setting was a long time ago. And so it's not something we deal with in our practice, but you're right. The CDC's just come out with a health advisory report on what's called MultiSystem inflammatory syndrome in children associated with coronavirus. And this is a syndrome that typically and it's hard to say typically when there's only been 100 cases, but it appears to be developing after children have gotten infected with the coronavirus. So it appears to be an inflammatory syndrome that may have been initiated by a coronavirus infection and may not be the direct result of the virus itself. It's really, something that's very new and something that people are really looking out for very closely. But the telltale signs so far is any kind of fever, and persistent fever really should trigger this, and you should go in and see a provider. And any evidence of inflammation that is concerning. And so, fever should be the big trigger. If your child's not acting right, get them in to see a provider. Everybody's going to be looking for this. And so this advisory has gone out widely. All our pediatricians are aware. And so this is something that we're on the lookout for, and we're going to be learning a lot more of this now that people are aware of it and can actually look for it and test for this. There's some telltale laboratory signs, and hopefully we'll be knowing more in terms of how to effectively treat it and what the impact is in our children. So new novel virus causing new kind of novel syndromes in children. It's going to take a little bit for us to generate some experience in some cases, but we're certainly on the lookout for it.
Yeah, and if Intermountain finds out any information too, we'll definitely release stuff on it to inform the public of what's going on. So the last thing I wanted to touch base on before we head off today is the move to yellow that's happening tomorrow. So they're not the entire state of Utah. It does not apply to Salt Lake City, which is actually a lot smaller than people think. If you look at a map of where the different city-county lines lie, Salt Lake City is actually pretty small. There's also West Valley City, Grand County, and Summit County that are staying in that orange phase, but everyone else is moving to yellow. And with that, there was the guidance of up to 50 people for private gatherings. Pools and rec centers are now opening, as well as sports leagues. For what this means for the community is kind of what I want to talk about. As you decide to start going to other places and there's going to be more people, what are some things that you really need to keep doing? And do we need to just jump to go to the pool, or should we be a little bit more cautious about what we're doing?
Yeah, you're going to have to really make these decisions based on your comfort with risk. And that's really what it comes down to. What we can say is in many areas, we're not seeing a decrease in case counts. Okay, so we know that the virus is still circulating in the community. We're able to test for it. We're able to take care of you in the hospital, if those things are needed. But our case counts, haven't dropped. And so this really has to be evaluated in terms of your comfort at risk and the potential chance for badness if you were to get the infection, in terms of, could you transmit it to, an elderly parent? Do you have somebody who's immunocompromised in your house? Are you immunocompromised? Do you have other comorbidities that put you at higher risk for a bad event if you were to get infected? All those things you have to think about before you start interacting with the community. The things I worry about is, pools, for example. They say you can go to pools, but we have to maintain social distancing. Well, I think we've all been to community pools and we've seen how children play. It's going to be pretty hard to keep kids from yelling and screaming and not playing with each other within 6 feet. So I think that's going to be challenging, and you're really going to have to think through how you're going to handle that as a family. Salt Lake City, as you said, is not making that change. West Valley is not making that change. But, there's big areas. Utah County, for example, is making that change. Davis County. And so you're really going to have to be careful with it. I can tell you, we are pretty risk averse, and we're not going to be really changing the way that we interacting with the community at this point, just because we haven't seen a decrease in case counts. And so, yes, I would be cautious though, and continue to wear the face mask, continue to do social distancing, wash your hands, support local businesses, how you can feel comfortable doing so. We do takeout from them, for example. But you really have to use your level of risk to determine how this is going to change your day-to-day life.
I think that's really good advice, is that it depends on you. Like you said, no one can make you do anything. So just taking it into your own hands is kind of the thing to do. Really quick on that same topic of pools, someone asked about a lap pool. I'm assuming since it's typically just you, that's probably a lot safer.
Yeah, this question has come up before. I think lap swimming is actually relatively safe. I'm not worried about the virus being transmitted by the water. As long as, it's a chlorinated pool, like all, community pools are, that's not going to be an issue. Lap swimming is a very solitary sport. You're not in the face of anybody else. So I do think, lap swimming is a very safe kind of form of exercise. I think the thing you just have to be cautious about is that if you're in the lap pool and then you go to the locker room and you're touching all sorts of things, just be really careful in terms about hand hygiene in those instances.
That's good advice. Well, Eddie, thank you so much for joining us. I will be really curious to see what happens next Friday with case counts. These updates have been really helpful for my family in deciding what to do. So I really appreciate it. A few numbers before we leave. We still have our COVID-19 hotline available for people if they would like to get screened and tested. It's 844-442-5224. We also have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. You can call someone to get support, whether it's for you or someone else. It's just a really great resource. So those are there for you still. And Eddie, thank you again, and we will talk to you next week.
Okay, take care.
Thanks.